Defining palliative care. Palliative care is specialized medical care for people living with a serious illness, focusing on providing relief from the symptoms and stress of a serious illness. The goal is to improve quality of life for both the patient and the family, addressing physical, psychological, social, and spiritual needs. This type of care is provided by a specially trained team of doctors, nurses, and other specialists who work with a patient's other doctors to provide an extra layer of support. It is appropriate at any age and at any stage in a serious illness, and can be provided along with curative treatment. Unlike hospice care, which is typically for those with a prognosis of 6 months or less, palliative care can begin at diagnosis and continue for years. It emphasizes comfort and dignity, ensuring patients can live as fully as possible. The World Health Organization defines palliative care as an approach that improves the quality of life of patients and their families facing problems associated with life-threatening illness, through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems. This holistic approach extends beyond physical symptoms to include psychological, social, and spiritual aspects of care. It aims to support patients in making informed decisions about their care, respecting their values and preferences. The ultimate goal is to provide comprehensive support that enhances well-being and allows patients to maintain their autonomy. It is a fundamental human right to receive such care. Philosophy and principles. The philosophy of palliative care is rooted in the belief that every individual deserves to live with dignity and comfort, even in the face of a serious illness. It acknowledges that dying is a natural process and aims neither to hasten nor postpone death. Instead, it focuses on affirming life and regarding dying as a normal process. This philosophy extends to providing support systems to help patients live as actively as possible until death. It also supports families to cope during the patient's illness and in their own bereavement. The core is a holistic approach, addressing all dimensions of human experience. This comprehensive view ensures that care is tailored to the individual's unique needs and values. Key principles guiding palliative care include respecting patient autonomy, ensuring open and honest communication, and providing comprehensive symptom management. It emphasizes early integration, meaning palliative care should be introduced alongside curative treatments from the time of diagnosis. Another crucial principle is the interdisciplinary team approach, where various professionals collaborate to meet the complex needs of patients and families. Furthermore, palliative care is committed to continuous assessment and adjustment of care plans as the patient's condition evolves. It also prioritizes cultural sensitivity, ensuring care is delivered in a manner that respects diverse beliefs and practices. These principles collectively uphold the patient's quality of life as the paramount goal. Goals of palliative care. The primary goal of palliative care is to achieve the best possible quality of life for patients and their families, regardless of the stage of illness or the need for other therapies. This involves preventing and relieving suffering through meticulous assessment and treatment of pain and other physical symptoms. It also extends to addressing psychological, social, and spiritual distress. Recognizing that these aspects profoundly impact a person's well-being, the aim is to support patients in maintaining their independence and engaging in activities that bring them joy for as long as possible. Ultimately, palliative care seeks to provide comfort and support, allowing patients to live fully and meaningfully. Another crucial goal is to facilitate open and honest communication between patients, families, and the healthcare team, ensuring that care aligns with the patient's values and preferences. This includes assisting with advanced care planning, helping patients articulate their wishes for future medical treatment. Palliative care also aims to provide a support system to help families cope during the patient's illness and through their bereavement. It integrates psychological and spiritual aspects of patient care, offering a comprehensive approach that respects the individual's entire personhood. By focusing on these multifaceted goals, palliative care strives to alleviate suffering and promote well-being for all involved. Distinction from hospice care. While both palliative care and hospice care aim to provide comfort and improve quality of life for individuals with serious illnesses, a key distinction lies in their timing and focus. Palliative care can be initiated at any stage of a serious illness, from diagnosis onward, and can be provided concurrently with curative treatments. It offers an extra layer of support, helping patients manage symptoms and stress while still pursuing aggressive therapies to treat their disease. This means a patient can receive chemotherapy for cancer and palliative care simultaneously. The goal is to alleviate suffering and enhance well-being throughout the entire illness trajectory, not just at the end. It's about living better, longer, with support. Hospice care, on the other hand, is a specific type of palliative care that is reserved for individuals who have a life expectancy of 6 months or less, as certified by a doctor, and who have decided to stop curative treatments. The focus of hospice is exclusively on comfort and quality of life, without any attempts to cure the underlying disease. It provides comprehensive support for the patient and family during the final stages of life and into bereavement. While all hospice care is palliative care, not all palliative care is hospice care. Understanding this distinction is crucial for patients and families to make informed decisions about their care options, ensuring they receive the most appropriate support at each stage of their illness journey. Role of the palliative care team. The palliative care team is an interdisciplinary group of professionals dedicated to providing comprehensive support to patients and their families. This team typically includes physicians, nurses, social workers, chaplains, nutritionists, and other specialists, each contributing their unique expertise. Their collaborative approach ensures that all aspects of a patient's well-being, physical, emotional, social, and spiritual, are addressed. The team works together to develop an individualized care plan that aligns with the patient's values and goals, constantly adapting it as needs evolve. They serve as a crucial resource for both patients and families, offering guidance, education, and emotional support throughout the illness journey. This integrated care model is fundamental to effective palliative care delivery. The team's primary responsibilities include expert symptom management, proactive communication, and coordination of care. They focus on alleviating pain, nausea, fatigue, and other distressing symptoms, utilizing both pharmacological and non-pharmacological interventions. Effective communication involves engaging in sensitive discussions about prognosis, treatment options, and advanced care planning, ensuring patients and families are well informed and empowered. Care coordination involves navigating the complex healthcare system, connecting patients with necessary resources, and ensuring seamless transitions between different care settings. By working cohesively, the palliative care team strives to enhance the patient's quality of life and provide comfort and dignity at every stage of their illness. Physician's contribution. The physician plays a central and critical role within the palliative care team, primarily focusing on medical management and clinical decision-making. They are responsible for diagnosing and treating complex symptoms, particularly pain, nausea, dyspnea, and fatigue, using a wide range of pharmacological and non-pharmacological interventions. The physician also provides expert medical guidance on prognosis, disease progression, and treatment options, helping patients and families understand their condition and make informed choices. They often act as the primary medical point of contact, coordinating care with other specialists and ensuring continuity of medical support. Their expertise is vital in navigating the intricate medical landscape of serious illness. Beyond symptom management, the palliative care physician engages in sensitive discussions about goals of care, advanced directives, and end-of-life planning. They possess strong communication skills, enabling them to convey complex medical information with empathy and clarity. The physician also contributes to the interdisciplinary team by providing leadership, clinical oversight, and medical education to other team members. They are instrumental in ensuring that medical interventions align with the patient's values and overall care plan. Their comprehensive medical knowledge, combined with a compassionate approach, makes them indispensable in providing high-quality palliative care. Nursing care in palliative settings. Nurses are at the forefront of palliative care, providing direct patient care and serving as a vital link between patients, families, and the rest of the healthcare team. Their responsibilities include meticulous symptom assessment and management, administering medications, and performing wound care. Nurses are skilled in identifying subtle changes in a patient's condition and responding promptly to ensure comfort and stability. They also provide essential education to patients and families on managing symptoms at home, medication administration, and recognizing warning signs. Their continuous presence and hands-on care make them indispensable in maintaining the patient's physical well-being and comfort. Nurses often spend the most time with patients, building trust and rapport. Beyond physical care, palliative care nurses offer significant emotional and psychological support. They are adept at active listening, providing a comforting presence, and helping patients and families cope with the emotional challenges of serious illness. Nurses often facilitate difficult conversations, acting as advocates for the patient's wishes and ensuring their voice is heard. They also play a crucial role in coordinating care, communicating with other team members, and ensuring seamless transitions between different care settings. Their holistic approach, combining clinical expertise with profound empathy, makes them central to delivering compassionate and effective palliative care. They are often the first point of contact for families with concerns. Social work and psychosocial support. Social workers are integral to the palliative care team, providing essential psychosocial support to patients and their families. They address the complex emotional, social, and practical challenges that arise during serious illness, helping individuals navigate difficult circumstances. Their roles include conducting comprehensive psychosocial assessments to identify needs related to financial strain, housing, legal issues, and access to community resources. Social workers act as advocates, connecting patients and families with appropriate services and ensuring they receive the support they require. They are skilled in crisis intervention and counseling, offering a crucial lifeline during times of distress. Their expertise helps alleviate non-medical burdens, allowing patients to focus on their well-being. Beyond practical assistance, social workers offer emotional counseling and support, helping patients and families cope with grief, loss, and the emotional impact of illness. They facilitate family meetings, mediate conflicts, and help improve communication within the family unit. Social workers also play a key role in advanced care planning, assisting patients in articulating their wishes and ensuring these are respected. They provide bereavement support, guiding families through the grieving process after a loss. Their holistic approach acknowledges the interconnectedness of social, emotional, and spiritual well-being, making them indispensable in providing comprehensive palliative care. They empower families to face challenges with resilience. Assessing pain. Effective pain management begins with a thorough and ongoing assessment of the patient's pain experience. This involves not only asking about the intensity of pain, but also its location, quality, for example, sharp, dull, burning, duration, and factors that worsen or alleviate it. Palliative care professionals utilize various pain assessment tools, such as numerical rating scales, visual analog scales, and Wong-Baker-Facer's pain rating scale. Especially for those who struggle with verbal communication, it is crucial to understand that pain is subjective, and the patient's self-report is the most reliable measure. Regular reassessment is vital, as pain can fluctuate and change in character over time, requiring adjustments to the care plan. A comprehensive assessment considers the physical, emotional, and functional impact of pain. Beyond quantitative measures, a holistic pain assessment includes exploring the psychosocial and spiritual dimensions of pain. Factors such as anxiety, depression, fear, social isolation, and spiritual distress can significantly amplify the perception of pain. Therefore, the assessment must delve into how pain affects the patient's mood, sleep, appetite, activities of daily living, and relationships. Understanding the patient's cultural background and beliefs about pain is also essential, as these can influence their expression and coping mechanisms. By taking a comprehensive approach, palliative care teams can develop a more effective and personalized pain management strategy, addressing all contributing factors to the patient's suffering. This detailed understanding helps tailor interventions for maximum relief. Pharmacological pain management. Pharmacological interventions are a cornerstone of pain management in palliative care, utilizing a range of medications to alleviate suffering. Opioids, such as morphine, oxycodone, and fentanyl, are often the most effective for moderate to severe pain, and their use is carefully titrated to achieve optimal relief with minimal side effects. Non-opioid analgesics, including NSAIDs and acetaminophen, are used for mild to moderate pain or as adjuvants to opioids. Adjuvant medications such as antidepressants, anticonvulsants, and corticosteroids are also frequently employed to target specific types of pain, like neuropathic pain or bone pain. The choice of medication and dosage is highly individualized based on the patient's pain type, intensity, previous responses, and overall health status. Regular review and adjustment are essential to maintain effective pain control. Administering pharmacological agents requires careful consideration of routes, dosages, and potential side effects. Medications can be given orally, subcutaneously, intravenously, transdermally, or rectally, depending on the patient's ability to swallow, absorption rates, and desired speed of onset. Education for patients and families about medication schedules, expected effects, and management of common side effects like constipation or nausea is crucial for adherence and safety. Palliative care teams prioritize a proactive approach, aiming to prevent pain rather than just reacting to it, often using around-the-clock dosing. The goal is to achieve sustained pain relief, allowing patients to maintain their functional abilities and quality of life without excessive sedation. This systematic approach ensures consistent comfort. Non-pharmacological pain management. Beyond medications, non-pharmacological interventions play a significant role in managing pain and enhancing comfort in palliative care. These approaches can be used alone for mild pain or as complementary therapies alongside pharmacological treatments. Techniques include heat and cold therapy, massage, acupuncture, and transcutaneous electrical nerve stimulation, TENS. Physical therapy and gentle exercise, adapted to the patient's abilities, can also help improve mobility and reduce pain. These methods often provide relief by reducing muscle tension, improving circulation, or stimulating the body's natural pain-relieving mechanisms. They offer patients additional options for comfort and control over their pain experience, empowering them in their care journey. The goal is to provide diverse avenues for relief. Mind-body therapies are also highly effective non-pharmacological strategies. These include relaxation techniques, guided imagery, meditation, mindfulness, and music therapy. These approaches help patients manage pain by reducing anxiety, diverting attention from discomfort, and promoting a sense of calm and well-being. Psychological support, such as counseling and cognitive behavioral therapy, CBT, can address the emotional and psychological components of pain, helping patients develop coping strategies. The integration of these diverse non-pharmacological methods into a comprehensive pain management plan allows for a more holistic and personalized approach, addressing the multifaceted nature of pain and improving overall quality of life. They offer comfort without additional medication side effects. Managing nausea and vomiting. Nausea and vomiting are common and distressing symptoms in palliative care, often caused by the illness itself, medications, or other factors. Effective management begins with a thorough assessment to identify the underlying cause, which can include constipation, electrolyte imbalances, gastric stasis, or specific drug side effects. Once the cause is determined, targeted interventions can be implemented. Pharmacological treatments involve antiemetics such as ondansetron, metoclopramide, or haloperidol, chosen based on the suspected mechanism of nausea. These medications are often administered proactively, especially before meals or chemotherapy, to prevent symptoms rather than just treating them once they occur. Careful titration and combination therapy are frequently necessary to achieve optimal control. Non-pharmacological strategies also play a crucial role in managing nausea and vomiting. These include dietary adjustments, such as offering small, frequent meals of bland, easy-to-digest foods, and avoiding strong odors or greasy foods. Maintaining good oral hygiene, ensuring adequate hydration, and providing a calm, well-ventilated environment can significantly reduce discomfort. Relaxation techniques, guided imagery, and acupuncture may also offer relief for some patients. It is important to educate patients and families on these strategies and to encourage them to report any changes in symptoms promptly. A multidisciplinary approach, combining medication with supportive care, is essential for effectively alleviating these challenging symptoms and improving the patient's quality of life. This integrated approach ensures comprehensive relief. Addressing dyspnea and respiratory symptoms. Dyspnea, or shortness of breath, is a highly distressing symptom frequently experienced by patients with advanced illnesses, significantly impacting their quality of life. Effective management requires a thorough assessment to identify underlying causes such as lung disease, heart failure, anemia, or anxiety. Pharmacological interventions often include opioids, particularly low-dose morphine, which can reduce the sensation of breathlessness without significantly depressing respiration. Bronchodilators may be used for obstructive airway diseases and diuretics for fluid overload. Oxygen therapy is indicated for hypoxemia, but it may also provide psychological comfort even in normoxic patients. The goal is to reduce the subjective feeling of breathlessness and associated anxiety. Careful titration and monitoring are essential for safe and effective treatment. Non-pharmacological strategies are equally important in managing dyspnea and respiratory symptoms. These include positioning the patient in an upright or semi-Fowler's position to optimize lung expansion and using a fan to direct cool air towards the face, which can stimulate trigeminal nerve endings and reduce the sensation of breathlessness. Relaxation techniques, guided imagery, and mindfulness can help reduce anxiety and improve coping. Energy conservation techniques and pulmonary rehabilitation exercises, adapted to the patient's capacity, can also improve functional status. Educating patients and families about these strategies empowers them to manage symptoms effectively. A multidisciplinary approach, combining medical treatments with supportive therapies, is crucial for comprehensive relief and improved comfort. This holistic strategy addresses both physical and emotional aspects. Fatigue and weakness management. Fatigue and weakness are pervasive and debilitating symptoms for many patients with serious illnesses, significantly impacting their quality of life and functional independence. Effective management begins with a thorough assessment to identify potential reversible causes, such as anemia, electrolyte imbalances, hypothyroidism, or medication side effects. Once reversible causes are addressed, non-pharmacological strategies become paramount. These include energy conservation techniques, such as pacing activities, prioritizing tasks, and taking frequent rest breaks. Encouraging light, regular exercise, adapted to the patient's capacity, can also help improve strength and reduce fatigue. The goal is to optimize the patient's energy levels and functional abilities, allowing them to engage in meaningful activities. Education of patients and families on these strategies is crucial for self-management. Pharmacological interventions for fatigue and weakness are less common but may be considered in specific circumstances. For example, corticosteroids might be used for their anti-inflammatory and appetite-stimulating effects, which can sometimes improve energy levels. Psychostimulants, such as methylphenidate, may be considered for severe cancer-related fatigue that is unresponsive to other measures, though their use requires careful consideration of side effects. Nutritional support, including dietary counseling and supplementation, is also vital to ensure adequate caloric and protein intake, which can combat weakness and improve overall energy. A comprehensive approach involves a combination of these strategies, tailored to the individual patient's needs and preferences, aiming to enhance their physical comfort and ability to participate in life. This integrated approach supports overall well-being. Effective communication skills. Effective communication is the cornerstone of compassionate palliative care, fostering trust and ensuring patient-centered decision-making. It involves not only conveying information clearly, but also actively listening to understand the patient's and family's perspectives, fears, and hopes. Key skills include empathy, demonstrating understanding and sharing feelings, and active listening, which means paying full attention, asking open-ended questions, and reflecting on what has been said. Nonverbal communication, such as maintaining appropriate eye contact, using a gentle tone of voice, and having an open body posture, is equally important in conveying warmth and sincerity. Creating a safe and private environment for discussions encourages openness and honesty. These skills build a foundation of trust, essential for sensitive conversations. Navigating difficult conversations, such as discussing prognosis, treatment limitations, or end-of-life wishes, requires specific communication strategies. The SPIKES protocol, setting, perception, invitation, knowledge, empathy, strategy summary, is a widely used framework for breaking bad news. It emphasizes assessing the patient's understanding, inviting them to ask questions, providing information in small chunks, and responding empathetically to their emotions. Avoiding medical jargon and using clear, simple language is crucial. Furthermore, acknowledging and validating emotions, even silence, is vital. Effective communication empowers patients to make informed decisions that align with their values, ensuring their autonomy is respected throughout their care journey. It transforms difficult moments into opportunities for connection. Breaking bad news. Breaking bad news is one of the most challenging yet critical tasks in palliative care, requiring immense sensitivity and skill. The goal is not just to deliver information, but to do so in a way that respects the patient's and family's emotional capacity, fosters understanding, and supports their coping mechanisms. Preparation is key, involving gathering all relevant medical information and anticipating potential questions and emotional responses. Choosing a private, quiet setting free from interruptions is essential to create a safe space for the conversation. It is important to allocate sufficient time, allowing for pauses and emotional processing. The healthcare professional must be prepared to manage their own emotions while remaining present and supportive. This careful preparation sets the stage for a compassionate interaction. The SPIKES protocol provides a structured approach to delivering bad news effectively. It begins by establishing the setting and assessing the patient's perception of their condition. Next, the professional invites the patient to receive information, asking how much they want to know. Then, knowledge is imparted in small, digestible chunks, avoiding jargon and checking for understanding. Crucially, empathy is demonstrated by acknowledging and validating the patient's emotional reactions. Finally, a strategy or summary is developed collaboratively, outlining next steps and offering hope in terms of support and symptom management, even as curative options are limited. This structured yet flexible approach helps ensure that bad news is delivered with compassion, clarity, and support, empowering patients and families to navigate difficult truths. Advanced care planning. Advanced care planning, ACP, is a crucial process in palliative care that involves discussions about future medical care and treatment preferences. It empowers individuals to make decisions about their healthcare in advance, ensuring their wishes are respected even if they lose the capacity to communicate. ACP is not a single event, but an ongoing conversation that evolves as a person's health status and values change. It typically involves discussing personal values, beliefs, and goals for care with family members and healthcare providers. The process helps clarify what kind of medical treatment a person would or would not want in various future health scenarios. This proactive approach reduces stress on families and ensures patient autonomy is upheld. The outcome of ACP often includes documenting these preferences in an advance directive, such as a living will or a durable power of attorney for healthcare. A living will specifies medical treatments a person wants or doesn't want at the end of life, while a durable power of attorney for healthcare designates a trusted person to make healthcare decisions on their behalf if they become unable to do so. Palliative care teams play a vital role in facilitating these conversations, providing information about different treatment options and assisting with the legal documentation. They ensure that the patient's voice is heard and honored, promoting peace of mind for both the patient and their loved ones. This process is fundamental to patient-centered care and respects individual choices. Ethical dilemmas in palliative care. Palliative care often navigates complex ethical dilemmas requiring careful consideration of patient autonomy, beneficence, non-maleficence, and justice. One common dilemma involves balancing the desire to prolong life with the goal of ensuring comfort and quality of life, especially when aggressive treatments offer minimal benefit but significant burden. Decisions around withholding or withdrawing life-sustaining treatments, such as artificial nutrition and hydration or mechanical ventilation, frequently present ethical challenges. These situations demand open communication, thorough understanding of the patient's values, and a clear articulation of the potential outcomes of different choices. The team must respect the patient's right to self-determination, even when choices differ from medical recommendations. Navigating these requires a strong ethical framework. Another significant ethical challenge arises when there are conflicts between the patient's wishes, family's desires, and the healthcare team's professional judgment. For instance, a family might insist on aggressive treatments against a patient's documented wishes, or when such treatments are deemed futile by medical professionals. Issues of informed consent, particularly when a patient's capacity for decision-making fluctuates, also pose dilemmas. Resource allocation, especially in settings with limited resources, can raise questions of justice and equitable access to palliative care. Palliative care teams are trained to facilitate ethical discussions, often involving ethics committees, to ensure that decisions are made thoughtfully, respectfully, and in the best interest of the patient while upholding ethical principles. These discussions are crucial for maintaining trust and integrity in care. Emotional and psychological support. Emotional and psychological support is a fundamental component of palliative care, recognizing that serious illness profoundly impacts mental well-being for both patients and their families. Patients often experience a range of emotions, including fear, anxiety, depression, anger, and grief, as they confront their mortality and the changes in their lives. Palliative care teams provide a safe space for patients to express these feelings, offering empathetic listening and validation. Interventions include counseling, psychotherapy, and support groups, tailored to individual needs. The goal is to help patients cope with emotional distress, maintain a sense of control, and find meaning in their experience. Addressing these emotional needs is as crucial as managing physical symptoms for overall quality of life. Family members and caregivers also require significant emotional and psychological support, as they often face immense stress, burden, and anticipatory grief. Palliative care social workers and counselors offer individual and family counseling, helping them navigate their emotions, communicate effectively, and maintain their own well-being. Support groups provide a valuable forum for sharing experiences and receiving peer support. For patients experiencing severe anxiety or depression, pharmacological treatments such as antidepressants or anxiolytics may be considered in conjunction with psychological therapies. A holistic approach ensures that the emotional and psychological health of all involved is prioritized, fostering resilience and promoting coping mechanisms throughout the illness trajectory and into bereavement. This comprehensive support strengthens the entire family unit. Spiritual care in palliative care. Spiritual care is an essential, often overlooked dimension of palliative care, addressing the patient's search for meaning, purpose, and connection in the face of serious illness and mortality. It recognizes that spiritual distress can manifest as feelings of hopelessness, isolation, guilt, or a questioning of one's faith or beliefs. Spiritual care is not necessarily religious. It encompasses a broader sense of transcendence, values, and personal meaning. Palliative care chaplains and spiritual counselors are trained to provide non-denominational support, respecting diverse belief systems and cultural backgrounds. They offer a compassionate presence, active listening, and facilitate discussions about existential concerns. The goal is to help patients find peace, comfort, and a sense of wholeness. This care is profoundly personal and tailored to the individual's unique spiritual journey. Interventions in spiritual care can include facilitating religious rituals, prayer, meditation, or connecting patients with their faith communities if desired. Chaplains can also help patients explore their life stories, identify sources of strength, and reconcile past conflicts. For those who do not identify with a specific religion, spiritual care might involve discussions about their values, legacy, and what gives their life meaning. Providing a safe space for these profound conversations can significantly reduce spiritual distress and enhance overall well-being. Palliative care teams integrate spiritual care into the holistic care plan, recognizing its crucial role in promoting dignity and peace at the end of life. This integrated approach ensures that all aspects of human suffering are addressed. Family and caregiver support. Family members and caregivers are the unsung heroes of palliative care, often bearing immense physical, emotional, and financial burdens while caring for a loved one with a serious illness. Palliative care teams recognize their critical role and provide comprehensive support to help them cope and sustain their well-being. This includes practical assistance, such as education on symptom management, medication administration, and hands-on care techniques, empowering them to feel more confident in their caregiving role. Providing access to respite care, which offers temporary relief for caregivers, is also crucial to prevent burnout. The goal is to acknowledge their contributions and ensure they have the resources needed to continue providing care without sacrificing their own health. Emotional and psychological support for families and caregivers is equally vital. Palliative care social workers and counselors offer individual and family counseling to help process grief, anxiety, and stress. Support groups provide a safe space for sharing experiences, gaining insights, and receiving peer support from others facing similar challenges. Open and honest communication with the healthcare team helps families understand the patient's condition and make informed decisions. Reducing uncertainty and conflict. By addressing the multifaceted needs of families and caregivers, palliative care aims to strengthen the entire family unit, enabling them to navigate the illness journey with greater resilience and support. This holistic approach extends care beyond the patient alone. Bereavement and grief support. Bereavement and grief support is an integral and ongoing aspect of palliative care, extending beyond the patient's death to assist families and loved ones through their loss. Grief is a natural and complex response to loss, manifesting in various emotional, physical, cognitive, and spiritual ways. Palliative care teams recognize that anticipatory grief often begins long before a death occurs, and support should be available throughout the illness trajectory. The goal of bereavement support is not to eliminate grief, but to help individuals navigate its challenges, find healthy coping mechanisms, and eventually adapt to life without their loved one. This support is tailored to individual needs, recognizing that each person's grieving process is unique and influenced by many factors. Interventions for bereavement support can include individual counseling, support groups, educational resources, and memorial services. Social workers and chaplains often play key roles in providing this support, offering a compassionate presence and guidance. Support groups allow bereaved individuals to connect with others who have experienced similar losses, fostering a sense of community and reducing isolation. Educational resources can help normalize the grief process and provide practical advice for coping. Bereavement support typically extends for a period of 12 to 18 months after a death, recognizing that grief has no set timeline. By offering comprehensive and sustained bereavement care, palliative care teams help families heal, find meaning in their loss, and rebuild their lives with resilience. This ongoing support is a testament to holistic care. Palliative care for children. Pediatric palliative care is a specialized field that focuses on providing comprehensive care for children living with life-limiting or life-threatening conditions and their families. It aims to improve the quality of life for the child and support the family from the time of diagnosis, throughout the illness, and into bereavement. This care addresses the unique physical, emotional, social, and spiritual needs of children, which differ significantly from those of adults. It is provided by an interdisciplinary team with expertise in pediatric development, pain and symptom management in children, and family-centered care. The goal is to minimize suffering and maximize the child's ability to live as fully and joyfully as possible. This specialized approach recognizes the unique vulnerabilities of children and their families. Key aspects of pediatric palliative care include age-appropriate communication, play therapy, and a strong emphasis on family involvement. Communicating with children about their illness and prognosis requires sensitivity and creativity, often using stories, drawings, or play to help them understand. Symptom management is tailored to the child's developmental stage and physiological responses, with careful attention to dosing and side effects. Support for the entire family, including siblings, is paramount, as the illness affects everyone. Bereavement support is also adapted to the unique needs of grieving children and parents. Pediatric palliative care aims to create a nurturing and supportive environment, ensuring that children can experience comfort, dignity, and a sense of normalcy despite their illness. It strives to bring joy and comfort into their lives. Palliative care in dementia. Palliative care for individuals with advanced dementia focuses on maximizing comfort, dignity, and quality of life as the disease progresses. Dementia is a life-limiting illness, and palliative approaches are essential to manage symptoms, prevent complications, and support caregivers. Key aspects include meticulous assessment and management of pain, which is often under-recognized and undertreated in dementia patients due to their inability to verbalize discomfort. Non-verbal cues, such as facial expressions, body language, and behavioral changes, become crucial indicators of pain and distress. The goal is to alleviate suffering, maintain functional abilities for as long as possible, and create a peaceful environment. This specialized care recognizes the unique challenges of communicating with and understanding individuals with cognitive decline. Beyond pain management, palliative care in dementia addresses other common symptoms like agitation, anxiety, sleep disturbances, and feeding difficulties. Non-pharmacological interventions such as music therapy, aromatherapy, gentle touch, and structured routines are often highly effective in reducing agitation and promoting calm. Dietary modifications and careful assistance with feeding are crucial to maintain nutrition and hydration. Advanced care planning is particularly important in early stages of dementia, allowing individuals to articulate their wishes before cognitive decline progresses. Support for family caregivers is paramount, as they often face significant emotional and physical strain. Palliative care aims to provide holistic support, ensuring that individuals with dementia receive compassionate, person-centered care throughout their illness journey. This approach ensures dignity and comfort. Palliative care in diverse settings. Palliative care is not confined to hospitals. It is increasingly delivered in a variety of settings to meet patients where they are most comfortable and to ensure continuity of care. These settings include patients' homes, hospices, long-term care facilities, and outpatient clinics. Home-based palliative care allows patients to remain in a familiar environment, surrounded by loved ones, while receiving comprehensive support. Hospice facilities offer a dedicated environment for end-of-life care, providing intensive symptom management and emotional support. Long-term care facilities integrate palliative principles to enhance the quality of life for residents with chronic and advanced illnesses. The goal is to provide flexible, accessible, and high-quality care across the continuum of illness. This adaptability ensures that care is truly patient-centered. Each setting presents unique opportunities and challenges for palliative care delivery. In the home, care teams must navigate the patient's living environment, often working closely with family caregivers and leveraging community resources. In long-term care facilities, palliative care focuses on staff education, proactive symptom management, and advanced care planning for residents. Outpatient palliative care clinics provide consultations, symptom management, and support for patients who are still actively pursuing curative treatments. The interdisciplinary team adapts its approach to the specific context of each setting, ensuring that the core principles of palliative care, comfort, dignity, and quality of life, are consistently upheld. This flexibility ensures that patients receive the most appropriate and effective care, regardless of their location. It emphasizes a seamless transition between different care environments. Future trends in palliative care. The field of palliative care is continuously evolving, with several key trends shaping its future delivery and accessibility. One significant trend is the increasing integration of palliative care earlier in the disease trajectory, often alongside curative treatments, rather than solely at the end of life. This shift emphasizes proactive symptom management and quality of life from diagnosis. Another trend involves leveraging technology, such as telehealth and remote monitoring, to improve access to palliative care, especially for patients in rural areas or those with limited mobility. Digital platforms can facilitate virtual consultations, provide educational resources, and offer continuous support, enhancing efficiency and reach. These advancements aim to make palliative care more widely available and responsive to patient needs. Furthermore, there is a growing focus on expanding palliative care to diverse populations, including those with non-cancer diagnoses like heart failure, kidney disease, and neurological conditions. This involves developing specialized training and resources tailored to the unique needs of these patient groups. There is also an emphasis on improving education and training for all healthcare professionals in basic palliative care principles, ensuring that a broader workforce is equipped to provide foundational support. Research in palliative care is expanding, exploring new interventions for symptom management and innovative models of care delivery. These future trends collectively aim to normalize palliative care, making it an essential and accessible component of healthcare for everyone facing serious illness, promoting comfort and dignity across all stages of life.